Hello and welcome back to Talks with Dr. Sisse's YouTube channel. I'm Dr. Aziza Sisse and I'm really excited about the video today because it is of our very first collaboration session. We had a special guest speaker, Miss Tito Oye, who is a sickle cell warrior. So you guessed it, we're talking about sickle cell disease. This is a very serious inherited blood disorder that affects millions of people around the globe. We just need to continue to raise awareness, and that's exactly what we did in this session. It was quite in-depth and quite powerful, so I really hope that you find it useful. Without further ado, let's get started. All right, so today we're going to be discussing what sickle cell disease is and the different types of sickle cell disease. We're going to also focus on sickle cell anemia and how it's inherited, what the symptoms and the complications are, why they occur, what the treatment options are, and then my favorite part, we're going to be having a chat with Miss Tito Oye, who is, as I say, a sickle cell warrior, and she'll talk us through her journey living with sickle cell disease. Okay, to begin with, I always like to engage with my audience, so I want you all to be involved, and I'd like to do a quick poll. And this is sort of to know what your baseline knowledge is, and I'm quite intrigued. So Zainab, if you don't mind, can you please put the poll up on screen? Amazing. I hope you can all see the poll questions on the screen. It's really easy. They're all just yes or no questions, and they're all anonymous, so don't worry. So the first question is, does sickle cell disease only occur in the Black population? So the question is a yes or a no. What do you think? Do you know your hemoglobin genotype? So when I say this, I mean, do you know whether you're a carrier of sickle cell or if you have sickle cell disease, or if your genotype is the normal genotype, which is AA. So whether you're AA, AS, or SS, do you know that? If you don't know what I'm talking about, then the answer is probably no. And then the third question is there a cure for sickle cell anemia? Yes or no? So let's begin. What is sickle cell disease? Sickle cell disease is a group of inherited health conditions that affect the red blood cells. But what are the red blood cells? So we have trillions of cells in our body. And one of the types of cells that we have, the blood cells that we have, is the red blood cell. And this is what it looks like. So it's round, it's disc shaped, it's actually quite flexible, and it carries the oxygen all over the body. And it carries the oxygen by a protein that is known as hemoglobin. So what's really amazing about red blood cells is that they're very, very flexible. So they can go through blood vessels, so the tubes that carry the blood around the body, by squeezing in even the tiniest vessels without there being any problems. Now, people with sickle cell disease have abnormal hemoglobin, and this hemoglobin is known as hemoglobin S, or sickle hemoglobin, okay? And these abnormal hemoglobin change the shape of the red blood cells so they become sickle in shape. So the red blood cells are normally in this sort of shape. So they're round, they're smooth, and as I say, they're quite flexible. But when you have the hemoglobin S, so the sickled red blood cells, they're in what we call a C shape or a crescent shape, kind of like the moon. And they have quite sharp edges. They're quite rigid, which means that they do break quite easily. They're not flexible. And they're also very, very sticky. So they stick to each other more. Now, to get sickle cell disease, you inherit two faulty genes, one from each parent. All right. So you always have two sets of genes, and you always inherit one gene from one parent and the other gene from the other parent. Sickle cell disease is a serious lifelong condition, but the severity does vary depending on the individual. So some people have a very mild form and they're okay. Others have the full-blown form, which can really be debilitating and change their life. So what's the prevalence of sickle cell disease? Now, sickle cell disease is prevalent or more common population of sub-Saharan African, South Asian, Middle East, and the Mediterranean. So Zainab, if you could put the poll answers up now, that's why I asked the first question. And it was just to see whether that you were aware that sickle cell disease does occur in the non-Black population. However, it is much, much more common in people of Black heritage. So looking at the poll, I'm pleased to see that 80% of you knew that it wasn't the case, that yes, sickle cell disease did occur in non-Blacks. And looking at the second question, do you know your hemoglobin genotype? 42% of you said no. I mean, I'm pleased that there's a higher percentage of you who do know, but I'll talk about why I asked that question when we get to the stage. Is there a cure for sickle cell anemia? 77% of you said no. Okay, we'll talk through that in a minute. Thank you so much for those of you who participated. So it's prevalent in sub-Saharan African countries, South Asia, Middle East, and the Mediterranean. So basically countries where malaria is quite endemic, more common. Now, what's scary is that over 300,000 babies are born with sickle cell disease every single year. And they're saying that that number is going to be going up gradually with time, and they predict that by 2050, it's going to go up to 400,000 babies being born every year with sickle cell disease. Nearly 90% of the world sickle cell disease population lives in 3 countries: Nigeria, India, and the Democratic Republic of Congo. Sickle cell disease related childhood death in Africa remains as high as 50 to 90%. So what that means is less than 50% of children who suffer with sickle cell disease will reach their 5th birthday. So that's a lot, and it's really, really sad and heartbreaking when we think about that statistic. So I wanted to talk to you about the types of sickle cell disease because I wanted you to gain the clarity about what sickle cell disease was versus sickle cell anemia. So in all types of sickle cell disease, at least one of the 2 faulty genes would be that hemoglobin S, so the sickle hemoglobin gene, which causes a person to make hemoglobin S. So that's the sickle hemoglobin that we were talking about. And the reason I'm talking about the types of sickle cell disease is because people then confuse sickle cell anemia with it being the only type of sickle cell disease. So if you have hemoglobin SS, that means that you've inherited 2 of the hemoglobin S genes from either parent. Then you have what's known as sickle cell anemia. And this is the most common and the most severe form of sickle cell disease. Another type of sickle cell disease is hemoglobin SC, which is sickle cell C disease. So that's where people have the sickle cell, the hemoglobin, so the hemoglobin S, but they also have an abnormal hemoglobin known as hemoglobin C. So that's sickle cell C disease. And then you have other different types. And I don't want to dwell too long on it, but I just wanted to emphasize this point, okay? If you do want me to elaborate on this later on, I can. But it's just to remember that sickle cell disease is the most common, sickle cell anemia, sorry, is the most common and the most severe form. And we're going to focus on sickle cell anemia from now on, okay? But I want to talk about sickle cell trait. So normal adult hemoglobin is known as hemoglobin A, okay? A person who has sickle cell trait will inherit 1 gene that makes the normal hemoglobin, so hemoglobin A, and another gene that makes a sickle hemoglobin, which is hemoglobin C. So they have what we, So they have what we call AS as a hemoglobin genotype that I'll talk to you about in a second. Now, people with sickle cell trait, majority of the times, they don't have any symptoms at all, and they lead their lives. And often, people with sickle cell trait, if they haven't done a blood test, they're not even aware that they have it. And they pass it on to their children in that way. Now, the thing about sickle cell trait is that they have a survival advantage when it comes to malarial infections. And this is why they think that this gene still exists, because the people who are carriers tend to be completely resistant to the malarial parasite. And so they live longer. And that's why this gene is really, really common in places where malaria is high. So when we talk about sickle cell anemia inheritance, we have to talk about the hemoglobin genotype. So there are 3 different types. We have the unaffected hemoglobin genotype, which is AA. So that's where you have both the hemoglobin A gene, which means that you have the normal hemoglobin, so you're unaffected. And then you have the sickle cell trait. Remember I said that you have both the normal hemoglobin A and the hemoglobin S, so that's classed as AS. And then the third type is sickle cell anemia. So a person with sickle cell anemia will have both the hemoglobin S gene that I was telling you about earlier. So for the purpose of the next slide, I have color-coded each individual genotype. So the unaffected person will be the gray one, the sickle cell trait is a purple, and person with sickle cell anemia is in red, okay? I think it's really, really important to understand how sickle cell disease or anemia is inherited, okay? Because this is where some of the misconceptions lie. And when I say possibilities in this regard, I'm talking about for every single conception. So every time you conceive a child, these are the potential possibilities you can have. So if we look at the top left corner and we focus on that combination where both parents have the unaffected hemoglobin, so hemoglobin A, so their genotype is AA for both parents. As I say, you get one gene from each parent. So these are the possible combinations that you get. And as you can see, in that situation, every single child, the chance or the possibility is that they'll be unaffected. There's no way that any of them will have sickle cell anemia or sickle cell trait. Now, comparatively, if we look on the right, the top right corner, you can see in this instance, it would be one parent that has the normal unaffected gene, so AA, and then another parent who has sickle cell trait, so AS. Now, when they have children together, again, you get one gene from either parent. These are the possible combinations. And you can see that 2 out of 4 of the combinations, so 50%, is AA or unaffected. So in this sort of combination, when the parent is unaffected or has AA and the other parent is a carrier or has sickle cell trait, there's a 50% chance for every single conception that the child will either have a sickle cell trait or be completely unaffected. Again, there's no way in that combination that they will have sickle cell anemia. Now, if we look at the third combination, and this for me is one of the most important ones, because that's where a lot of the misconceptions are. If both parents are sickle cell trait or sickle cell carrier, these are the possible combinations, okay? So you can see here, 1 out of 4 of the possibilities is AA. So 1 out of 4 will be unaffected, right? So there's a 25% chance for every single conception that the child will be unaffected. But then there's a 50% chance, so 2 out of 4, that the child will be a carrier or have sickle cell trait. And then there's 1 in 4 chance, so 25%, for the child to have sickle cell anemia. Now, the reason I wanted to focus on this is because there are loads of people who believe that if they're both carriers and it's 1 in 4 chance, then only 1 out of 4 of their children will have sickle cell anemia, which isn't the case. It's actually the possibility for every single conception. So even if your firstborn has it, your secondborn could potentially have it, and there's a 25% chance for that. So I want you to think about the genders, right? When you have children, it's 50-50, isn't it, for a boy versus a girl? Now, it doesn't guarantee that if you have a boy first, that your second one was going to be a girl. So imagine that whenever you think about the inheritance and the possibilities. When they say 25% or 1 in 4 chance, that's 1 in 4 every single time, okay? And that's why it's so important to know your hemoglobin genotype, because that's where a lot of people, unfortunately, then tend to have children who have sickle cell anemia and really struggle. So another possibility, if one parent is a carrier and the other parent has sickle cell anemia, then these are the 4 possible combinations. And you can see that 2 out of 4, or 50% of the combinations, would be carriers, and 50% will have sickle cell anemia. So in that regard, where one parent is a carrier and the other one has sickle cell anemia, it's 50-50 that the child will either have sickle cell trait or sickle cell anemia, and there's no possibility that any of the children will be unaffected. And then other possible combinations, if one parent is completely unaffected and has the normal genes, and then the other parent has sickle cell anemia, the chances of having sickle cell trait is 100%, and there are no other possibilities. And then if both parents have sickle cell anemia, again, there's 100% chance that the children will have sickle cell anemia, and there's no other possibility. I hope that makes sense. Okay, so how do we diagnose sickle cell anemia? We do this by doing a blood test. And the blood test can be done usually in the UK and in the US. They do antenatal screening. So they do screening when a woman is pregnant, and they check if she's high risk for having either the carrier trait, or if she's at risk of having sickle cell disease herself. And if she is high risk, then they do the checks, further investigations, and they can even do the checks to the fetus to find out whether or not the child has sickle cell anemia. But then there's also newborn screening heel prep test, which is done in the UK again, or the US. This is where they prick the heel of the baby, they get the blood sample, and then they can confirm, make a diagnosis then whether the baby has sickle cell anemia, or they even check if they have sickle cell trait at that stage. Or a blood test is done at any other time, particularly where it's suspected. So if someone is constantly coming in with symptoms and presentations as though they may have sickle cell anemia, then they would do the blood test at that point. Or again, if you're curious to know what your status is, you can just go and visit your doctor and ask to have a blood test done. So what are the complications of sickle cell anemia? Unfortunately, there are quite a few, and they happen for different reasons. So one of the biggest reasons that patients will have complication is because they usually have blockage of their blood vessels, so the tubes that carry the blood. And earlier, I told you that the red blood cells are very flexible, and they're able to sort of bend and change their shape so that they can go past narrow blood vessels. Now, when someone has sickle cell anemia, remember I said that the cells are more rigid, they're sticky, and they clump up together. So you can see in this picture that they've clumped up together here, and you can see that they've blocked up the blood vessel completely. So no blood is going to go past that area, and the part of the body that requires the blood, the oxygen, then starts to die off, and that causes very severe pain. And this is where patients present with acute pain crisis. And this is unimaginable, really severe, sharp pains depending on the area where the blockage is. And it can be triggered by different things. It could be triggered by the weather, if it's too cold, if the person is dehydrated, if they're really stressed out, or if they have an infection. This happens, and it's so unpleasant. Another thing that can happen is it can get hand or foot swelling, which we call dactylitis, and it's very, very painful. And this is what it looks like in an infant. And often infants who haven't been diagnosed with sickle cell anemia early on, this is how they would present, and it's extremely painful. And then if it happens, the blockage happens in the bones, that's where you get joints, aches, and pains. And if it's really severe, it can actually cause the bone to die, and they need a joint replacement. If it happens in the brain, it can cause strokes, so the brain starts to die off in the areas that aren't getting the blood supply. And sometimes it can cause what's called silent strokes. So that is where strokes are happening without the person realizing, but they're struggling, you know, to maintain their concentration, that sort of thing. And it's picked up by an MRI scan. And then if it happens in the spleen, now the spleen is an organ within our tummy that helps to fight infections, right? So if a blockage happens, then the spleen can swell up and become really enlarged. And if you think about the spleen as a balloon, there's a high risk if it enlarges too much that it can rupture, and then there's bleeding everywhere, and that's really, really dangerous. And they need to take the spleen out. Or what could happen, again, if they block the blood supply in multiple areas of the spleen, then you can have what's called a spleen infarct, which essentially is where the certain areas of the spleen die, so it doesn't work as well. And because the spleen helps to fight infection, this is what increases the risk of infections occurring. If the blockage happens in the penis, then you have a condition that's known as priapism. So what that is basically where you have an unintentional, completely intense, painful, persistently erected penis. And just to explain, in order for an erection to happen, blood needs to flow into the penis. And then once everything is done, for it to go back to being flaccid, the blood needs to flow back out. But what happens is, there's blockage occurring, so the blood can't flow out, and so it remains erected for a prolonged period of time, which is extremely painful. And as I say, if this goes on for more than 4 hours, they need to go into hospital. And if this happens a lot, it can eventually lead to impotence. If this happens in the lungs, it can cause really severe acute chest syndrome, which is where they get really intense pain in their chest, shortness of breath, a lot of fluids in their lungs, they can't breathe. If it happens in the eye, the blockage of blood vessels happen in the eye, that's where blindness can occur. And if it happens in the legs, it can cause ulcers, which is breakage of the skin that's difficult to heal, again, because the blood flow is really poor. And then I said, again, issues with the spleen means that they're more prone to having quite frequent infections. Another complication is the short lifespan of the sickle red blood cells. Now, I told you earlier that the red blood cells, the normal red blood cells, usually it lives for 90 to 120 days, okay? Whereas the sickle red blood cells, because it's quite rigid and easily breaks down, they only live for 10 to 20 days, which is much, much less than a normal red blood cell. And because of that, the body tries its best to replenish the red blood cells that are being lost. But unfortunately, it's not able to do that. And so the patient is anemic, okay? So they don't have enough red blood cells, and that leads to shortness of breath, tiredness, headaches, delayed growth, and delayed puberty. And when the red blood cells die, they release a chemical that causes the yellowish discoloration to different parts of the body, particularly the eye, and that's what we call jaundice. And then there is, we have a gallbladder, which sits just underneath our liver. And because, again, the red blood cells constantly die, there's a chemical in it that forms gallstones, which, if it causes any obstruction, can cause severe pain, infections, and so on. People with sickle cell anemia get kidney problems, so they're unable to concentrate their urine that well. And because of that, they end up constantly needing to pass water. And it gets to a point that they can't control it, so that's when bedwetting happens or they lose continence of their urine. And unfortunately, with everything that we've explained, people with sickle cell anemia have a reduced life expectancy. So the median age range is between 42 and 48. However, people who are managed well and lead that healthy lifestyle, they often live way past the age of 50. And again, I said that the severity can vary. So people with mild sickle cell anemia can actually live well into their 80s. And with everything discussed, it can cause quite severe mental health problems in patients, because they're constantly going into hospital, they're constantly in pain. You know, they know that they have a reduced life expectancy. And unfortunately, really sadly, pain is invisible, right? So, you know, they might be complaining of quite intense pain, but a lot of the time, people with sickle cell anemia say that they're not believed. So they end up, you know, having that resentment as well. And, you know, it's painful to be in pain and people don't believe you. So how do we treat sickle cell anemia? Most of the treatment is what we call supportive. So we encourage patients with sickle cell anemia to make sure that they keep well hydrated, they dress warm, they avoid stress, they have all their immunizations, because again, they're at increased risk. And the best thing would be early diagnosis. So if they're found either by antenatal or newborn screening, meaning that they can start treatment early, supportive treatment early, to prevent the complications that we discussed earlier. And there's certain medications as well that help. So there's a medication known as hydroxyurea or hydroxycarbamide, and they are said to reduce the painful crises episodes that the patients have. They help to reduce acute chest syndrome, and they can increase the long-term survival of patients with sickle cell anemia. And some patients are put on what we call prophylactic antibiotics, which is where they're given antibiotics to prevent infections from occurring. And again, painkillers because they're in constant pain. And they're also prescribed folic acid, which helps to increase the red blood cell production. And I mentioned earlier that you can have spleen problems. And if it's really bad, they'll have to remove the spleen. If you have gallbladder issues because of the gallstone, they'll need to remove the gallbladder. And a lot of patients with sickle cell anemia thrive on blood transfusion, again, because often they're anemic, or they get regular blood transfusion to reduce the stroke from happening. And also they get their blood exchanged, so their sickle blood is removed, and then the healthier blood is put back through blood transfusions. And this is why giving blood is so important. And I'll talk about that with Tito. And actually, 71% of you said that there wasn't a cure for sickle cell anemia. There is actually a cure, all right? However, it's quite an invasive and high-risk procedure, and it's known as bone marrow transplant. And this is where they rid the person with sickle cell anemia of their bone marrow, and they then insert bone marrow of a matched sibling donor so that it can be successful. So a sibling that has similar blood type and so on. However, it's usually very, very limited to patients who suffer with quite severe sickle cell anemia because of the risks involved. Okay, thank you so much to everyone for your patience. This is the part that I was most excited about, and it's to have a discussion with Tito. So if you can unmute yourself, or Zainab, if you're able to unmute Tito, then we can have the discussion. Tito is a lovely, incredible young woman who is what we call a sickle cell warrior. She is incredible because she is trying her best to raise awareness of what sickle cell anemia is and what it's like living with sickle cell anemia. And I thought it would be really helpful to have her chat with us. She also has her own Instagram page known as Her Sickle Journey, where she literally journals her experience. So I'm so pleased to have her here today.
Thank you so much for having me. Honestly, the first part was very informative and I really enjoyed it. So thank you so much.
Thank you so much for being patient. Thanks to everyone. Okay, so my first question to you is, can you please tell us about your sickle cell journey, when you realized you had it and how you've dealt with that knowledge?
Yeah. So when I was younger, so kind of like growing up with sickle cell, it wasn't really a thing that was talked about much in my house. Like my parents, like the typical Nigerian parents, they just didn't want to speak about it too much. They didn't want me to, like, what you confess is what you possess type of mentality. So it was kind of like on a hush hush, but they knew what I had to do to look after myself. So every second is, oh, Tissel, have you been drinking your water? Have you used your medicine? X, Y, and Z. So I knew what I had to do to stay as healthy as possible, but I didn't really understand why. It wasn't until I was around 10 years old. I remember I was in school and it was cold outside, or it was raining. And whenever it's raining, that's just, I know that I'm not allowed outside for a break. So I asked one of my friends, I was like, oh, can you stay inside with me? And she was like, why? And I was like, oh, because I have sickle cell. And she was like, oh, what's that? I said, I don't know. And then my teacher overheard and she was like, oh, basically it's where your red blood cells are, instead of them being like the normal circular shape, they're more like a crescent shape. And then doing things like going outside when it's cold can cause them to stick together, which can cause a great deal of pain. So that was like my first real understanding of why I have to do certain things and why I can't do certain things as well. And then I think from that point, then I started taking it kind of into my own hands in terms of making sure that I knew everything I had to know about this condition. And then it was, I guess it wasn't until I was in university where I started sharing it. So I still kind of kept it on the down low, in the sense where people only knew about my health if I let them know, or if it was family. And then with uni, I guess with my friends, because I wasn't around family then, with my friends who are visiting me in hospital. And then if they're visiting me in hospital, they need to know why, like, why are they coming? What's wrong? So I started sharing with them, and then they encouraged me to start sharing more. So yeah, that's kind of how everything just got started. Yeah.
Okay, that's amazing. You're so strong. I was wondering how having sickle cell disease has impacted your life, like your career, your education. Has it impacted your life in that sense?
Yeah, no, definitely. I would say, I guess I kind of noticed it more in university. So I didn't know that stress could be a trigger for a sickle cell crisis until I was in like my third year of university, where I had like 7 pieces of coursework. I had 7 exams to revise for. I had my dissertation, and around that period of time, I was in and out of hospital like every month. Like it was, and I'll be there for at least like weeks on end. And then it started to make sense. And then one of the nurses was like, "Oh, maybe it's stress that's causing this." And I was like, "Yeah, that's actually true," because I was ridiculously stressed at the time. So yeah, I think it did impact my work in terms of I had to like continuously ask for extensions, and there'll be times where like, I've used up, so I get like a 2-week extension, but I'm still in the hospital, so I'll be in the bed still trying to type away at my laptop, try and make sure that at least I hand in something. So it's been difficult, but then there have been people who have helped me a lot along the way, which I'm really grateful for. People who've helped me to manage it. Yeah.
Oh gosh, that sounds so hard. You're a soldier doing work in a hospital. Oh my God. So what's it like then when you have a crisis? What's that experience like for you?
It's sometimes it feels so surreal. Like as someone with sickle cell, like I know how it feels, but just the way that it can happen so quickly is crazy. So one moment I can be fine, and then the next moment, if a crisis starts, sometimes it can be so bad where like I have a crisis in my legs, my arms, and my back, so that I can't walk. But I look fine from the outside, and I was feeling fine just an hour ago. So sometimes it's just crazy because I'm like, I should be able to walk, but my body's just saying no. And it's just like a constant, like an aching or throbbing or like a really sharp pain. And I find it difficult to give like an accurate like explanation of how it feels, but it's just, I guess it's just one of those things where I'll just try my best. But yeah, it's just something that is debilitating. Like if it's really bad, you just can't do anything, and then you just have to focus on yourself and just drink water, use painkillers, hot water bottle, and then distractions are things that just help you not to focus on the pain itself. But yeah, and then if it gets really bad to the point where I know I can't look after myself, then that's when I would call like the ambulance or ask someone to take me to the hospital so that they can look after me, and I can use stronger painkillers and things like that.
I'm so sorry.
Okay.
How would you say that has this affected your family? Would you say having sickle cell anemia?
Yeah, so I'm the only one in my family with it, thank God. I have a younger brother, he's AA. I have a younger sister who's AS. And it affects her, and she has some symptoms of anemia, low iron. With my parents, I guess now that I think back to like my childhood, there'll be times where like I'll suddenly have a crisis. They have to drop everything and carry me to the hospital. So I never really thought about it, but now thinking back, I think that yeah, it's been a hindrance on many occasions. Let's say we're going to like a party or something, but I'm not feeling well. They have to leave, and it's just like it's not ideal. Like it's never ideal, but as a parent, that's it's their responsibility to like, look after me and stuff. So they did what they could all the time, and there'll be times where like even if it's a thing, I remember when I was in uni once and I wasn't looking after myself properly, like I wasn't using my medicine consistently, and I was in the hospital. And then my mum, she literally drove all the way from London up to Leicester, like overnight because she was so worried. So yeah, so they do everything that they can to help me. They'll be making sure if they know anyone in the area, they'll be asking them to like cook for me and stuff like that. So they do go out their way to help, and I really do appreciate it a lot. But yeah, they do try a lot, yeah.
God bless them, and God bless
Yeah.
you. God. So the last question I have to ask is, if there's one thing that you can tell the audience today, or you'd like them to leave this session with, what would that be?
It would just be like just to continue what you're doing now in sense of educating yourselves. I feel like as someone with sickle cell, I think the most touching thing for me is someone like, let's say a friend, when I started sharing with them about my health, they would go away, they would do their own research and come back to me and ask me like so many questions. And it's really moving in the sense where like it just reminds me that they care enough to research about it, and then to then go on and find out their genotypes. And then also when it comes to giving blood, I've been really like active in terms of getting people to donate. But it all stemmed from my friends who, like, I think they saw me in the hospital once and they were like, oh, we want to do what we can to help. So then they started getting blood, and I was like, oh, this is actually really important. And then I've started to push that a lot now. So yeah, I think just educating yourselves about sickle cell, and just like with that education, actually using it. So in terms of finding out what your genotype is, so that so we kind of break the cycle, and just yeah, that's what I would say.
Oh, thank you so much again. I really appreciate you coming on to educate the people who are here. I really appreciate it. And there's so many messages from people saying thanks for the awareness and they appreciate your braveness. So
Thank you for having me.
No, of course.
For having me.
So I just wanted to quickly wrap up, and essentially Tito said what my take home message is, which is please know and find out what your hemoglobin genotype is, because in that in itself, it will then give you an idea of what your risk is and what your potential risk, depending on, you know, the partner you choose when you then go on to have children. Because if you're a carrier and then you marry someone who is a carrier as well, you need to be aware of the risks that do exist. And also have these discussions, have them with your loved ones, have them with your family, your friends, so that, you know, we can raise awareness about sickle cell disease. And also we can hopefully support people like Tito who need the support from us, you know, who are struggling with the sickle cell disease. And also, if we have these discussions, we could potentially reduce its prevalence. Please, please, please give blood. As I said earlier, blood donations are what help to prolong the lives of people with sickle cell disease, because they're anemic. They need the blood. Now, I'm gonna say here that unfortunately, only 5% of blood donors are from ethnic backgrounds, so Black, Asian, or ethnic minorities, and only 1% are Black. And when it comes to giving blood, it helps when people are closely matched, so an ethnicity matched essentially. And the rare blood types or subtypes are found within people of Black heritage. So we need to give blood to help people like Tito. We really need to start giving blood. It doesn't take much. I'm gonna put a link on the chat box. Just there's an organization known as Give Blood, Spread Love, and you can register to give blood through them for the UK, or you can register anywhere. Please do. And finally, a healthy, balanced lifestyle is paramount. It's necessary for people everywhere, but it's even more necessary for people with sickle cell disease, because they have a higher risk of complications, as we spoke about. I understand that would have been a really difficult watch, and, you know, a very, very sensitive subject to discuss. But it's real life, and there are millions of people, as I say, suffering with it, and there's still millions of babies being born with the condition. So there's so much that we can do as individuals. Continue to talk about this with your family and friends, continue to raise awareness, continue to understand. Please know your genotype, as I said in the session, and give blood. It's simple, it doesn't take much. I mean, if you're able to, obviously not everyone is able to give blood, but if you can encourage other people to as well, it makes such a big difference, and it does save loads of lives. Okay, well, you know, stay tuned for more sessions to come. I really hope that so far you're finding these videos useful. If you have any suggestions of sessions that you would like us to cover, or videos you'd like me to make separate to the sessions, I'd be more than happy to do that. All right, then, you take care. Bye.